Hey there everyone, and welcome back to Studying with Stephanie. Today we're going to continue our diagnostic imaging series, and we're going to discuss computed tomography or CT scans. So let's get into it. So what is a CT scan? A CT scan essentially is an X-ray that takes continuous images and can take images from about 1,000 different angles. And these images are converted from analog images to digital images through pixels. It was discovered and developed in 1972 and was meant to visualize soft tissue impairments and go further beyond what a plain radiograph can do. So when a patient is undergoing a CT scan, the patient moves through the gantry, which is the CT machine, and the coils circle around the patient to detect electrical currents. Then the X-ray is continuously taking these images through the cross sections of the body, again to convert the image from analog to digital. Now, the radio densities are how the image differentiates between the different tissues. Something like cortical bone is going to be very radio dense and appear lighter on a CT scan versus air, which is going to appear as radiolucent or transparent, see-through on the CT scan, and it's going to appear dark. So with the CT image, the soft tissue structures, appear as different shades of gray. Now, when we're looking at fat versus soft tissue, those shades of gray are very hard for our eye to detect. So the operator of the CT can actually change the image and the grayness of the image so that we can detect the different radio densities of these materials. And this is called the windowing effect. So when the operator is looking at the image and we want a soft tissue window, we're going to look and see what different densities that we can place so that the image can appear more clear and detailed for the viewer. And for the different shades of gray, these are actually called Hounsfield units. When the CT images are being taken, initially a scout image is taken. And this scout image is a plain radiograph, and it's going to help to orient the viewer to what tissues and what structures are being visualized. So the scout image essentially is the big picture so that the person reading the CT scans, the thousands of different images that are being taken, can orient themselves and know where they are spatially when it comes to the body. Now, a CT scan is determined on the quality from the beginning based on the megavolts and the milliamperes. Those are the initial context that is set for the CT scan. But after the image is actually taken, again, we have some play and editing ability so that we can better detect tissues. So after the image is taken, we can change the contrast of the image, the density of the image, and the spatial resolution. The spatial resolution essentially is depicting whether we're going to have a large amount of volume and image in the photo, or we're going to have a smaller image in the photo. So the spatial resolution is good for detecting smaller objects. When we're looking at something like a small joint, the slices that the CT scan is taken are going to be smaller because of the anatomic structures being so congruent in that area. Versus something larger like the lungs, the slices are going to be larger. So the slices can vary anywhere from 0.5 millimeters to 8 millimeters, depending on the structures and how big of a view that we want on that CT scan. Anytime we're viewing images, there are different planes that we are taking those images in. So images for CT scan can be taken in the axial plane, and the axial plane is going to cut the body in that transverse plane. So we're going to be viewing from top to bottom or bottom to top. And then we have the coronal plane, and I think of the coronal plane as putting a crown on your head. So we're kind of cutting the body into front and back portions here. So that's how we're viewing this image, from front to back. And then we have the sagittal plane, which is that straight down, cut down the middle of our eyes, we're going to view that image from left to right or vice versa. The images below also show the different planes, and this is a knee CT scan. There are a couple things within the CT scan that can go wrong and cause image degradation or a faulty view of the image. So things like beam hardening, which is when the low energy photons get absorbed into the tissues and it causes dark streaks along the image. And then we have metal artifacts. So anytime there's metal in the body, it's going to skew the image and it's going to create this bright beam and sometimes streaks throughout the photo. You can see the image on the left-hand side, there is a metal artifact in that hip. So this pelvis has a bright white spot in it, and there are some streaks going across that pelvis, which is not normal in the CT. And then motion. So anytime someone moves in a CT scan, we're going to get streaking or blurring. So there are a few different types of CT scans. Three-dimensional CT scans are great at viewing complex anatomical structures, but these are only really viewed in the digital format. In print, they are not viewed very well. But the beauty about it is the operator or the viewer can manipulate the picture, and they can essentially go around the whole entire anatomic structure to view those complexities of the image. And then we have the myelogram CT. The myelogram CT is actually used with contrast agents put into the subarachnoid space. And the myelogram CT is great at detecting ligament infolds, osteophytes, and annular material. It is good for any spinal stenosis, again, because that contrast agent is put into the subarachnoid space, so we're going to get a better view anytime there's a contrast agent put into the imaging. And then they excel at looking at structural impingement in the three-dimensional form. So these myelograms are going to be more for those ligament infolding, osteophytes, spinal stenosis type of issues. And then we also go through neuroimaging. Neuroimaging are used anytime there's an acute trauma. Then we're going to get that CT of the brain because they're faster and they're good at detecting intracranial bleeding. So the neuro image can look and detect ischemic strokes. So anytime there's an ischemic stroke from embolism, a vasospasm, so that blood vessel constricting, spasming, loss of cardiac output, arterial sclerosis, all of these things can cause that ischemic stroke, and that can appear in that CT scan, which is going to be the image on the left. When that blood vessel gets blocked, now that blood is not going to the other parts of the brain, causing cell death. Now these show as small round lesions, and it could be anywhere in the brain stem, in the basal ganglia, in the thalamus. That's commonly where they occur. And then the large vessels can also, the thrombosis can show up and they can appear more radiodense. So they're going to be brighter on that CT scan and the surrounding brain tissue, which is what you're seeing on the image on the left. And then cerebral lesions are going to be dark because of the edema. And then the CT scan also shows cerebral hemorrhaging. So this is going to be the image on the right. And a hemorrhage is any time a blood vessel breaks and that blood is poured out into the surrounding structures. As time goes on though, the CT image of a hemorrhage is going to appear a little bit darker because intensity of that fluid is going to become less radiodense. So there are a few pros and cons of CT scans. CT scans are great at detecting subtle fractures, complex fractures, degenerative changes, and they are the first go-to option for any acute trauma because of the speed the image can be taken and it can view multiple body parts. So anytime someone's coming into an ER, they are typically getting a CT scan to rule out any intracranial bleeding, especially with those acute traumas. And then the cons are CT scans do have high radiation rates, and these radiation rates have actually gone up 7-fold from the 80s to the early 2000s. But again, with the change of computer and technology, all of this can change as well. CT scans are also harder at differentiating between similar radio densities of the tissues But that's why we have the windowing effect, where the operator can choose what type of radio densities and what type of gray colorations they want in the image so that the viewer can better detect between the different tissues. So that's CT scans. I hope that this video helped. If there's anything else you'd want to hear from me to help with your tutoring and to help with your success of your physical therapy or physical therapy assistant school, please drop it in the comments below. I am here to help you. If you want one-on-one tutoring, again, reach out and I'm happy to help. As well, if this video helped you, please subscribe down below and share with your friends. Thank you for coming to Studying with Stephanie and have a great day. Bye.